Welcome to Medicare 101. The basics of Medicare. Your Medicare by AYA and Associates is a senior benefits practice, specializing in the senior market, particularly Medicare plans, final expense, retirement planning. With over 25 years of industry experience, we are uniquely prepared to help seniors and their loved ones find the right solutions for their Medicare and other insurance needs. We are independent brokers who work to help you find the Medicare insurance plan that is right for you. Topics of discussion. Number 1. An overview of Medicare. Number 2. Review of Medicare Part A, B, C, and D. Number 3. Enrollment timeline. Number 4. Discussion of Medicare Advantage Part C. Number 5. Discussion of Part D, prescription drug coverage. Number 6. Question and answer period. What is Medicare? Medicare is the federal health insurance program for people who are 65 years of age or older, for certain younger people with disabilities, for people with end-stage renal diseases, permanent kidney failure requiring dialysis or transplant, sometimes called ESRD. Medicare is administered by the Centers for Medicare and Medicaid Services. New Medicare card. Medicare has four parts. Part A, hospital insurance. Part B, medical insurance. Part C, Medicare Advantage. Part D, prescription drugs. Part A, hospital. 1. Inpatient care in hospitals. 2. Skilled nursing facility care. 3. Hospice care. 4. Home health care. Paying for Medicare Part A, hospital insurance. What does Part A cost? Most people get Part A premium free. If you or your spouse paid FICA taxes at least 10 years, 40 quarters. If you paid FICA taxes less than 10 years, you can pay a premium to get Part A of up to $506. Part A deductible for 2023 is $1,600. Part B, medical. Number 1, services from doctors and other healthcare providers. Number 2, outpatient care. Number 3, durable medical equipment. Number 4, discussion of Part D, prescription drug coverage. Medicare Part A and B together are also known as Original Medicare. Paying for Medicare Part B, medical insurance. What does the Part B cost? There is a monthly premium that can vary depending on your income level. $160 for $90 in 2023 for most new Medicare enrollees. For a beneficiary that make $91,000 or less, couples $180 to $1,000. There is a yearly deductible, $226 in 2023. Most services have a 20% co-insurance. May have to pay an income-related monthly adjustment amount. May be subject to a premium penalty, late enrollment penalty. If not elected when first eligible, penalty is an additional 10% of the premium for each full 12-month period without coverage. Things to consider when enrolling in Medicare. Your initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday. Include the month you turn 65 and ends 3 months after you turn 65. Enrollment is automatic if getting Social Security or RRB benefits. Most people pay a monthly premium, usually deducted from SSH RRB benefits. Amount depends on income. What to do if you're still working after age 65? If you do have coverage through active employment, you may want to delay Part B. Check with your employer or union benefits department to find out if you should or need to take Part B. If you decline Part B and stay on employer coverage, evaluate your coverage each year during your employer open enrollment to determine if you might be better served by a Medicare health plan. No penalty if you enroll later while you have coverage, or within 8 months of losing coverage. Your Medicare options. Step 1. Decide how you want to get your coverage. Original Medicare, Part A, hospital insurance, Part B, medical insurance. Step 2. Decide if you need to add drug coverage. Part D, prescription drug coverage. Step 3. Decide if you want to add supplemental coverage. Medicare supplement coverage. Medigap policy. Medicare Advantage Plan. Part C, like an HMO or PPO. Part C combines Part A, Part B, and usually Part D. Step 2. Decide if you need to add drug coverage. Part D, prescription drug coverage. Most Medicare Advantage plans cover prescription drugs. You may be able to add drug coverage in some plan types if not already included. If you join a Medicare Advantage plan, you can't use and can't be sold a Medicare supplement insurance, Medigap policy. What is Medicare Advantage? A Medicare Advantage plan is another way to get your Medicare coverage. Medicare Advantage plans contract with Medicare to provide services equivalent to Medicare coverage. They are paid a fixed amount monthly to cover the costs of your care and must follow Medicare rules. If you join a Medicare Advantage plan, you will get your Part A and Part B, and usually your Part D coverage from the plan. You may be required to use a specific network of providers. You will be subject to the premiums, co-insurance, and co-payments of the plan. Types of Medicare Advantage plans. There are different types of Medicare Advantage plans. There are several types of plans available: HMO, PPO, PFFS, SNP. Plans usually include Part D coverage. Plans are offered in specific coverage areas, and not all areas will have all types of plans. Plans have varying premiums, co-insurance, and co-payments that are different than original Medicare. When can you join, switch, or drop a Medicare Advantage plan? When you first become eligible for Medicare. If you become eligible for Medicare due to disability between October 15 and December 7th, anyone with Medicare can join, switch, or drop a Medicare Advantage plan, referred to as the annual election period. Plan changes become effective from January 1st. If you have a special election period, you move out of your plan's service area. You have become eligible for or lose Medi-Cal. You qualify for extra help. You live in an institution like a nursing home. If you enroll in a plan that has a 5-star rating. DSNP Special Needs Plans. What is in DSNP? A dual special needs plan is for people on Medicare, Medicaid, or medical. These types of plans give access to doctors, specialists, and hospitals contracted with the health plan. Benefits that may be included in DSNP. Part D, RX coverage, vision, gym, transportation, hearing aids, personal emergency response systems, 24/7 nurse line, OTC benefits, over-the-counter benefits catalog. When can you join, switch, or drop a Medicare Advantage plan? During the open enrollment period, January 1st through March 31st. If you're in a Medicare Advantage plan, with or without drug coverage, you can switch to another Medicare Advantage plan. With or without drug coverage, you can disenroll from your Medicare Advantage plan and return to original Medicare if you choose to do so. You will be able to join a Medicare prescription drug plan if you enroll in a Medicare Advantage plan. During your initial enrollment period, you can change to another Medicare Advantage plan with or without drug coverage, or go back to original Medicare. With or without drug coverage, within the first 3 months, you have Medicare. Part D, prescriptions. Number 1. Helps cover the cost of prescription drugs. Number 2. Run by Medicare-approved private insurance companies. Number 3. May help lower your prescription drug costs and help against higher costs in the future. Paying for Medicare Part D, prescription drugs. What does Part D cost? Your cost will vary based on your prescription and which ones are covered by your plan, the plan you choose, which pharmacy you use, preferred or non-preferred, whether you get extra help, whether you pay an income-related monthly adjustment amount, whether you have to pay a late enrollment penalty. If you don't enroll when eligible and don't have other coverage, you pay a late enrollment penalty, usually for life. Penalty is equal to 1% of the base beneficiary premium. $30 to 0.7 for in 2023 for each month you are eligible for coverage and not enrolled. $3.7 for monthly penalty for each year without coverage in 2021. Things to consider when enrolling in Medicare. Your initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday. Includes the month when you turn 65 and ends 3 months after you turn 65. Your enrollment will be automatic if getting Social Security or retirement railroad benefits. Most people will pay a month premium for Part B. The amount depends on your income and will be deducted from your Social Security if you sign up later or if you do not sign during your initial enrollment period. The exception to the penalty rule is if you have creditable coverage. How does Medicare work if I'm still working and have insurance through you, employer? If you have creditable coverage through your employer, you may want to delay paying for Part B until you retire. What is creditable insurance? Creditable coverage. Health insurance coverage under any of the following: a group health plan, individual health insurance, student health insurance, Medicare, Medica, Champus, and Tricari. The Federal Employees Health Benefits Program, Indian Health Service, the Peace Corps, Public Health Plan, Children's Health Plan, or a state health insurance high-risk pool. If you have prior creditable coverage, it will reduce the length of a pre-existing condition exclusion period under new job-based coverage. Help people with limited income and resources. Extra Help, a Social Security program that helps pay for prescriptions. Medicaid, federal and state program helps people with limited income and may pay for Part B and Part D. Thank you. For more information, please contact us.